watching Reality Check. Even as Omicron surges in India, officials and experts here and around the world point to how, while it may be more contagious, it appears to be milder than earlier variants. But equally, others say that given the possibility of a huge number of infections, even if only a small fraction become critical, it could still end up straining hospitals, particularly ICUs. So to estimate the pressure on an Omicron wave might place on ICUs is a challenge, given the scarcity of consistent data and given how information on Omicron is still evolving. Regardless, going by the general scientific consensus, which suggests that Omicron is about 4 times more transmissible than earlier variants, and using available data from big cities to extrapolate the impact of a third wave, it does suggest that ICUs in urban centers across India might come across considerable strain, with Mumbai and Chennai falling short by 1,000 to 1,600 ICU beds, a shortfall of close to 60%. Bengaluru could fall short of almost 2,000 ICU beds, a 50% shortfall. Let's just break down the numbers to show you city by city how we've arrived at these numbers. So if you look at Mumbai, the current ICU occupancy is 1% of all active cases. Only 1% of all the cases are in ICU. But active cases at the second wave, the peak was 92,500. Active cases in the third wave could be projected almost 3.7 lakh because Omicron is 4 times more contagious. ICU beds currently available are 2,600, but the projected could be 4,200, the peak of the third wave. So we're 62% short in Mumbai. Let's look at Chennai. Current ICU occupancy is 1.4% of active cases. Active cases at the peak of the second wave, almost 50,000. The projected active cases at the third wave peak could be almost 2 lakh. ICU beds available are 1,800, but almost 2,800 ICU beds could be needed. Again, a shortfall of 60%. Bengaluru now. Currently, the ICU occupancy is 0.5% of active cases. But during the second wave peak, it was 3.7 lakh active cases. The third wave peak projection for Bengaluru could be as high as almost 15 lakh cases. Currently, there are 5,000 ICU beds available, but Bengaluru could end up needing over 7,000 ICU beds, a shortfall of about 50%. Let's look at the numbers for Delhi, where at least one city where it doesn't appear as dire. The current ICU occupancy is just under 1% of active cases. The second wave peak of active cases was 1 lakh. The third wave peak could be projected to be almost 4 lakh, which means that Delhi, which has 3,500 ICU beds, could end up needing 3,700 beds at the peak of a possible third Omicron wave. Let's look at overall the national picture. Again, this is all projections. At the second wave peak, India had about 37 lakh active cases. A third wave Omicron peak could see almost 1.5 crore cases. That could mean India as a whole needs about 1.5 lakh ICU beds. Now, there's no official data to tell us how many ICU beds are there across India, but it gives you a sense of what India is likely to be up against in the event of a major Omicron surge. All right, joining me tonight on Reality Check, Dr. V. Ravi, Nodal Officer for Genome Sequencing, Government of Karnataka, also Head R&D, Tata Medical and Diagnostics. Dr. Rahul Pandit, who's part of Maharashtra's COVID-19 Task Force, also Director Critical Care at Fortis Hospitals. Dr. Sunita Nara Reddy, Infectious Diseases Physician, Apollo Hospitals, Hyderabad. Dr. P. Sarat Chandra, Professor Neurosurgery at AIIMS. Well, let me start with Professor Srinath Reddy, President Public Health Foundation of India. Always good to have you back on the show. Is this sort of, Dr. Reddy, given the somewhat confusing and not very consistent data on Omicron, is this the right kind of way to look at it in terms of if we just look at what could be, because hospitalizations, if you look at overall, a lot of people are being taken to hospital even if they're not suffering from severe disease. government has mandated almost everyone with Omicron to be hospitalized. So the important thing seems to be, look, is it deadly dangerous ICUs? And it does suggest, Dr. Reddy, that even a milder Omicron, because of the infectious potential that it has, could end up putting quite a load on our ICUs.
Well, basically, we are looking at two things. What is the likely scenario that will emerge?
Yeah.
And what should be the nature of our response?
Yeah.
In terms of the scenarios, what you have projected as an extrapolation
Yes.
from the second wave is a sort of the worst case scenario.
Right.
Taking into account that even a small fraction of a very large number of Omicron infected cases may require intensive care. Are we ready for it or not?
Yes.
But it's not just the question of how many the virus is going to infect, but also how many of the susceptible individuals are even partially protected now as compared to the second wave.
Right.
We do recognize that a very large number of the most vulnerable people above the age group of 45, those with comorbidities, are people who have been exposed to prior infection or to vaccination. They are not fully immune. They are likely to get infected. They may even have mild disease. Some of them may develop severe disease, but we recognize there is at least partial protection among many of them.
Right.
Therefore, it may not necessarily a simple mathematical equation that we are looking at.
Of course.
The second question, of course, is how can we spread this out? Now, during the Delta wave, we really had a huge surge. Can we actually stretch out this Omicron despite its high infectivity by taking all the public health measures that are required to slow down the transmission between different regions and between people, so that we don't have a huge surge all at one time, challenging
So
the
instead
health
of a
system
sharp spike, you have a more gradual kind of curve. So, right.
You stretch it out.
Stretch it out. Okay.
And also, if many of the cases are mild, we should try and attempt at home care, supported and supervised home care, rather than crowding them in the hospitals.
Okay. That's one way of looking at it. But Dr. Pandit, if one looks at it again, like I said, these are projections. And speaking to officials in Mumbai, seem quite confident that there are enough beds. I was talking to the Mumbai Municipal Commissioner just a few days ago. But I mean, really, if you're looking at a projection of about 3.7 lakh active cases measured against the peak, second wave peak, 3.7 lakh cases, you may end up needing almost 4,000 ICU beds in Mumbai. And currently, the BMC dashboard says you only have about 2,600.
Yes, so good evening. Your projections are again an extrapolation, like what Dr. Reddy said. Well, we also need to understand that there are two aspects to this. One aspect is that there are a lot of small nursing homes who have 2-bed, 5 beds ICU, which probably may not be the part of the count which is there in the Bombay Municipal Corporation. Plus, the borders of Mumbai are actually adjoining with Thane and Navi Mumbai, where there are multiple other ICUs and smaller hospitals as well. Which
but they will also be facing. But hold on.
Yes,
they will also be taking in people from those areas.
Yes, and vice versa. Mumbai also takes in a lot of patients from Thane and Navi Mumbai as well. So it's a mix. It's a bit of a mix there. And I think that's one way of just disseminating it out. But my bigger concern, which I have for the ICU, is that a lot of patients are actually incidentally positive and requiring ICU care. People who have come in for a routine surgery have tested positive before the surgery. People who have come in for as a myocardial infarction are testing positive for COVID. And those are the patients who are also going to occupy the bed. It's not just going to be the COVID who are requiring oxygen. It's going to be people who are having some other disease processes for which they may require ICU as well, but probably occupy. So your projections may actually be probably based on the wave 1, but I think there is a little bit of a concern here which I do have. But I do feel that confidently with the smaller nursing homes, if they pitch in, which is what we will probably see happen, we will be able to cover up a lot of ICU beds requirement.
Okay, well, let's hope for the best. But Dr. Sunita Nara Reddy, infectious diseases physician, Apollo Hospitals. Firstly, what are you seeing in the Apollo network, Hyderabad and elsewhere? Are you starting to see COVID ICUs starting to get fuller than earlier, even with this supposedly mild Omicron?
Thank you for that question. And yes, Apollo, we have several hospitals across the country. We've seen definitely increased numbers in certain parts of the country. For example, in Delhi, Kolkata, Chennai, we are seeing more numbers. I don't think we've filled up the beds as yet. We're still good over there. Hyderabad, the numbers are much less. So we are in a fairly comfortable position. So the numbers are definitely rising. What would concern me more today is not just the availability of hospital beds. Thanks to the first and the second waves, I think we have done a fairly good job in terms of creating infrastructure in terms of the number of beds, ventilators, oxygen. For example, a lot of hospitals now have their own oxygen supplies. And so a lot of the infrastructure has actually improved. However, what I would be more worried about is healthcare workers. We are seeing a tremendous rise in the number of COVID cases, and a lot of healthcare workers are falling sick.
Yes.
So that's one challenge I'm anticipating going forward.
Yes. Yes.
Hospitals are not just beds. We need manpower.
No, absolutely. In fact, last night our program focused exclusively on infections amongst healthcare workers across the country. So that is quite a worry. But Dr. Sarat Chandra, Professor of Neurosurgery at AIIMS, if you look at the numbers now in Delhi, look at the jump in terms of the number of occupancy. We have data for Delhi and Chennai. As I said, data can be limited. So we are only taking it from places where we have clean data. December 27th, there were 34 ICU beds occupied in Delhi. By January 6th, that had jumped to 213. That is as of today. It's a 500% plus jump. Chennai, it's jumped in the same period from 73 to 111. It's a smaller jump, 52%. But it's indicating that even this so-called mild Omicron, because it's contagious, so the denominator is so much bigger, even 1%, less than 1% criticality is going to start putting pressure on ICUs.
So, yes, that's a very relevant question. Now, as already reiterated by Professor Reddy, what you have shown is a very, very simple linear extrapolation. But in reality, that is how it doesn't work, because there are a number of variables. And among the important variables already mentioned by Dr. Reddy, some other variables, if I'm not already repeating myself, is obviously the severity of the disease. It's not very severe. So it remains to be seen whether they actually translate into this many ICU beds. For instance, in the second wave, a huge number of patients still required oxygen, which is not happening during the third wave. Secondly,
so
we are now dealing with the population.
So, yeah, that's why we didn't look at oxygen, because a lot of doctors, hospitals are saying oxygen, we're putting people on oxygen, but it's not the same. We just looked at ICU. And as far as the infectivity is concerned, we looked at 4 or 5 cities where the percentage of those admitted to ICU. So on the basis of that, we calculated as a percentage of total active cases, and everywhere it was in the range of between about 1 to 1.5% in ICUs. So that was the basis on which to extrapolate.
Absolutely. See, I'm not actually saying anything against this extrapolation. We have to be prepared for the worst and hope for the best. But what I'm saying is, you are thinking of a linear curve, but when it pans out in reality, it may not be a linear curve.
Sure.
And the extension of this curve could be variable. And the other factor, what I was mentioning, just to continue, is that we are dealing with a population, a huge population, which is already vaccinated or already has had a previous infection.
Yep.
And a third important factor is the recovery rate is also very rapid. In most of the hospitals, the number of admissions is equivalent to the number of discharges.
No,
Now,
that's
what
true.
is of major concern,
Yes.
as again pointed out by Dr. Reddy from Apollo Hospital, is that we are finding a lot of healthcare workers falling sick. And considering the fact that this is 4 times more infectious, we will expect a pyramid which is going to be very, very steep. And in this critical period, if our healthcare workers fall sick,
Yeah.
we may not be able to, or we may have the challenge of meeting the healthcare requirements to these patients who would rapidly come in the next couple of weeks.
No, that's true.
And
That is a
lastly,
problem.
of course, we have an expert here, Mr. Ravi.
That
But
is a
lastly,
problem.
but not the least, I would
Let
also
me,
like
let me move on though, because now we have to all make quick points because there are many of you. We'll come back for second round. Dr. Ravi, in Karnataka, just looking at it, because again, if you look at the projection, and of course one can, we're not saying this is exactly what's going to happen, but again, just look at the projection, because you have about 5,000 ICU beds. You could end up needing over 7,000 ICU beds. Is the government, are the health sort of those in charge aware of this? Are they trying to add ICU beds? What's the strategy here? Okay, sir, you've muted yourself. If you could just unmute, Mr. Doctor.
Thank you, Srinivasan. The government is fully aware. In fact, we have been having preparatory meetings for the last 10 days, every 2-3 days reviewing the situation. As you have shown in the graphic, the percentage of people developing serious disease in Bangalore is among the lowest compared to all other cities. I'm not saying it that is a chance. The Bangalore has had the highest coverage of vaccination among think you are covering in this particular show. So I think vaccination is a very important factor to consider. And as all other panelists, starting from Dr. Srinath Reddy, our senior colleague, it is not going to occur in one particular day. It is going to be a little spread out. You are making a arithmetic projection. Biology, I presume, does not follow simple arithmetic.
Sure.
There are a lot of surprises and variables. But your point is well taken. We need to be prepared. And as others pointed out, the bigger worry is going to be lack of healthcare personnel.
But at the
we'll
same
have
time,
to right now start thinking about
I agree that's
for them.
Okay, but I come back to it that regardless of whether A projection or B projection is valid, my question is that because the main focus now appears to be that you have to save lives. You're not, because governments are not now looking at taking severe steps like lockdowns and so on. So the main thing is to basically avoid critical illness, criticality. So to that end, is there a move to expand ICU beds and ventilators and all of that on a war footing? That's what I'm asking.
Yes, in Karnataka, yes, there is a phased plan to increase ICU beds.
Yeah.
Because last time around, we did not have enough ventilators. Subsequently, a large number of ventilators have been procured. So it is planned to have additional beds converted into ICUs in many of the large hospitals in Bangalore.
Okay. Oh, okay. That's good. But, Dr. Reddy, I wanted to ask you that if you are saying that, look, you have to stretch it out, you don't want a sudden sharp spike, you want something more gradual, which makes sense, so that you don't overwhelm ICUs and all of that, and you try to reduce deaths. And you said use public health measures. At the moment, though, government, center and state are still hesitant to, go the whole way. Partial curfews, nightly curfews, things like that, not going in for a full lockdown type scenario. You think is that needed, Dr. Reddy, to stretch it out, or can it just be done through this way of partially trying to control crowds and so on?
Lockdown is like an emergency brake. You should use it only when absolutely necessary. And I believe the first time around, we used the lockdown mostly to build up capacity within the system for a reasonable response. Now, what we need to do is to slow down the epidemic and slow down the transmission.
How?
And there are a lot of health measures will have to be determinedly utilized. Just weekend lockdowns are not going to be particularly helpful. The virus is not a visitor only on the Sabbath.
So, in what are the ways then? How else?
Very clearly, we must ensure with adequate public education, using all the channels and means at our disposal, that we must mask up. And unless the masks are used regularly, the risk of infection still remains. Secondly, avoid super spreader events. Thirdly, prepare our health systems better for supervised and supported home care so that we don't rush the hospitals with cases that do not require hospitalization or intensive care. One method of conserving our intensive care capacity or hospital capacity for the patients who actually need them is to treat majority of the people who are going to be mildly affected at home, proper primary health care, supported as per need by community health volunteers who can be trained.
Fair enough, but I come back, as I said, to the crux of it, which is if the idea is, Dr. Sunita, to save lives, to not this time worry about spread and transmission, let's just try to protect people who are critical. Do you see that urgency? Do you see, that attempt to expand the ICU ventilator infrastructure? I mean, are you seeing that in Hyderabad, for instance?
Mr. Srinivasan, that's a very good question. But this is not the time where we actually have should not be looking at to increase the capacity. We should have been doing that when the first wave hit us and the second wave hit us. And I think we've done a fairly good job at doing that in terms of building capacity. For example, if you talk about Hyderabad, there's one huge hospital built up, TIMS, 400 bed capacity exclusively for patients with COVID. Apart from that, if you talk about Telangana, Andhra Pradesh, both states, I think about close to 60 to 70 government hospitals in the district and sub-district levels, like area hospital also. 10-bed ICUs have been created thanks to the support also from Nirman and other organizations like that, where we've actually set up ICUs in smaller hospitals so that we don't have to move all of these people into the cities to larger hospitals. So I think the capacity building has occurred. So we, at least Telangana, I think we are in a reasonably good shape in terms of bed capacity. Fortunately or unfortunately, I think we had an overcapacity of beds, and that has helped us in the situation.
Dr. Pandit, now today Mumbai has hit 20,000 cases a day. This is what Mr. Chahal, BMC Commissioner, was telling me. He said, like everyone is saying, we don't want to get into lockdowns and all of that, but if we cross 20,000 a day, then we may have to start thinking about more stringent measures. Otherwise, again, same worry. You have even a mild variant could put a huge pressure on, hospitals and critical care.
Yeah, you're right. 20,000 you'll have to start thinking, or 30,000 you'll have to start thinking. What I want to say is that you cannot increase the capacity of your intensive care overnight. You may build up a hospital with 100 or 200 beds of ICU. Where are you going to get trained personnel to work in that? Even if everybody is healthy and everybody is working, you don't have people to work in there. So the plan should be that we should have focused guidelines which help. I'm not going to repeat what Professor Reddy just said. Focus guidelines which tell us which patients to be managed where, and if they do come up in ICU, how do you manage them? Use the technology to our benefit. Extend the technology to tele-ICU and telemedicine to the rural areas, so that we can actually utilize those capacities quite well. And that's been done across the states, whether it is Maharashtra, Karnataka, Tamil Nadu, Andhra Pradesh, everywhere it's been done. So I think that's what we need to do. Fortis Group has got a COVID expert group which actually manages all the 40 hospitals of Fortis, which we tell which patient should be in ICU and which patient can be managed in the wards.
All right. Well, let's see.
Like that.
Let's see how it plays out, because at the moment we've only been talking of cities. We've not even talked about what's happening outside cities, where there is far less of a safety net of just whether it's hospitals, ICUs is another story altogether. But we're out of time. Thank you all so much for joining me. Thank you for watching. Good night.